voilà, bonjour, bienvenue dans notre deuxième temps. Pareil l'habitude, nous adresse Topik Konversasyon. Et aujourd'hui, un topic qui s'y mène beaucoup de madame, qui t'apprend porte les oreilles, mais aussi encouragement de messieurs pour participer de sa conversation. À cause, je crois qu'il est, nous pouvons décider pour nous entrer dans tel traitement IVF. Et aujourd'hui, nous pouvons faire cette conversation pour nous apprendre beaucoup d'informations. Le topic, si nous pouvons imaginer, planifier.baba, et nous pouvons gagner certaines difficultés. Est-ce qu'il y a un traitement qui peut être soutenable pour vous? Est-ce qu'il y a un traitement qui peut être ou sentir ou envie d'explorer? Comment un couple? Aujourd'hui, mon matin, je crois the ideal person pour nous faire cette conversation avec, c'est pas l'autre qui est Dr. SUGANYA. Good morning. How are you, doctor?
Bonjour.
Bonjour.
Moi bien, merci.
Très bien. How's it been for you? I mean, New Year.
Yes, a very happy New Year 2025
Thank
to all
you.
out there and to you especially.
Thank you
And
so much, Doctor.
Ujole, you look very beautiful today.
Thank you, doctor. And this morning, of course, we're here. Of course, before we go into that, we're very nosy here. We're just going to check on you again. Are we still with the same routine in the morning, or has it changed to adapt to 2025? Tea, coffee, water. Of course, I know coffee is not a go-go for you.
Yeah.
Tea?
Yes, a
Very
black
good.
tea.
Okay.
A black tea with no sugar.
Black tea with no sugar.
No
doctor.
sugar.
Okay.
Sugar is a strict no-no for any woman out there or
Okay.
anybody in person
Oh,
because
gosh.
it is a very, very dangerous to our health. It has causes all the problems like obesity, diabetes, infertility too. So cut down the sugar, those who are really health conscious. Instead,
Doctor, it's, how can I say this? Harder said than being done, isn't it?
yes, very true.
Là,
but
moi, ça kata d'ici, franchement, I love sweet things, so I have to work on it. 2025, nous pouvons travailler ensemble. Nous pouvons travailler ensemble, hein? Nous pouvons arrêter que ça d'ici. Si nous sommes en D, nous prenons N. Après, nous réduisons 0. Hopefully. Fingers crossed. So today's conversation, doctor, of course, welcome back. We're going to talk about IVF. Now, first of all, just that IVF in itself, I'm pretty sure it represents something. There's a meaning behind it. So let's start with the word itself. IVF, the acronym. What does it stand for?
okay, IVF stands for in vitro fertilization.
Oh.
This actually means when the fertilization happens outside the womb of the women.
Okay.
It is a overall name given for subdivisions in the IVF. Generally, people think IVF is taking the baby and putting it inside the womb.
Okay.
It is not so. We collect the sperm, we collect the egg,
Yes.
and then we unite it, form the embryo,
Okay.
and then place the embryo inside. This whole procedure is put under the name of IVF.
Okay. Ladies and gentlemen, mesdames et messieurs, la voilà. For those of you wondering, IVF in Gain Decree. Now, let's go to the process itself, as you
Yes.
said. How easy or how difficult? I know this happens in the lab, obviously, under very
Yes.
safe circumstances, everything. How does this procedure go about? Of course, as you said, the sperm, the female egg.
Yes.
Walk us through this process, because I'm pretty sure a lot of people out there who are probably considering
Yeah.
thinking of this process of having this treatment,
Yeah.
they would want to know the specifics of that.
I would be really glad if I can throw that particular light on how it is done.
Yes.
So, coming on to the subject of how it is done,
Okay.
first we collect the sperm from the male partner
Okay.
and we freeze it.
Okay.
And
Fresh,
second-
doctor?
Fresh
So the
sample.
person has to be at the hospital.
At the hospital.
Okay.
If the person has got a reasonably good sperm count.
Okay.
It is very important.
Okay, let's stick with this before we move any
Yes.
further. A reasonably good sperm count. What is a reasonably good sperm count?
So, the count of at least 20 million is required.
Ooh.
So, generally, a normal sperm count will be more than 35 million.
Okay.
Anything that falls short, then we have to be on a red alert zone.
Okay.
So, all male partners who are having difficulty in having this baby formation needs to go for first test of semen analysis.
Okay.
The semen analysis will tell what is the total count, what is of the total count, what are the healthiest sperms, and of the healthy sperms, how many percentage can move inside.
Okay.
So this gives us a overall outline of what exactly is the capacity of the male partner.
And this takes how long about?
It only takes 10 minutes.
10.
The person walks,
All right, doctor.
the person can walk into the lab,
Yeah.
but strictly after 3 days of no sexual activity.
That's the important. Okay, all right.
Yes, very true. After 3 days of no sexual activity, the person can reach the nearest lab and can give a fresh sample collected in the lab.
Okay.
That is more precise in giving the result rather than collecting the sample at home and carrying it to the lab.
Okay.
The transit time destroys the motile sperms.
Okay.
So I always recommend my patients to reach the lab and collect the sample fresh after 3 days of strict no sexual activity.
But see, that's the thing. A lot of the time, sorry guys, I know you're probably going to take this the wrong way, but it's not in bad intention. Sometimes the gentlemen have a bit of fear when,
Yes.
because this is an intimate moment, isn't it? And it's something that well, I don't want to say defines you as a man, but to a certain extent,
Yes.
their manhood.
Yes.
You know, it's passing on their legacy.
Yes.
Their,
Yes,
You
it's
know?
very true. We respect every person who has this trouble of donating or extracting
Yes.
this sample. So for them, we recommend the nearest possible less than 2-kilometer radius so that they are aware that they should reach the lab. The moment they collect, they should rush the sample to the lab. But other than that, most of the men out there who really respect pregnancy or who are in dire need of a baby will go through this,
Yes.
having understood what is the procedure, because absolute privacy is provided for them
Yeah.
to collect the sample. Adequate counseling is given to them about the sample that is collected fresh and that can give us a proper result from the lab, other than collecting the sample at home and delivering it to the lab. Rather, we go to the lab
Yeah.
and give the sample, we read the result, and there you go. And from there on, we can take care where exactly the treatment starts.
Doctor, I know this question was coming. Can the lady accompany the man, or would it, in my opinion, it probably would cause contamination, isn't it? I mean,
Not
No,
really.
not really.
Not really. The lady, if the man requires her woman by his side,
Yes.
yes, of course,
Okay.
he can.
A lending
But-
hand.
Yeah. But still, we prefer the men to walk into the lab
Yeah.
free and then collect it without any stress or without any tension. That is the most prior thing.
You're on your own, boys. You're on your own. On this note, we continue our conversation. And of course, pareil, nous dit, si on veut faire nos conversations, dès 88 89 89, numéro qu'on capable WhatsApp nous pour plus questions. Now, so we've talked about the boys. Now, let's talk about the ladies.
Yes.
Similarly, as we say, the boys assume that everything is fine, the swimmers are good.
Yes.
The ladies also.
Okay, this is a very nice question. Having now defined the male partner
Yes.
is absolutely good
Okay.
with all the count, the motility, everything. Now we focus on the lady.
Okay.
And now here comes the egg collection.
Okay.
So for her to donate her eggs or to retrieve her eggs from her body, she needs to go through certain blood investigations and an ultrasound. To begin with, a woman needs to be assessed by a basic hormone test known as anti-Mullerian hormone, AMH.
Okay.
That exactly correlates to the quantity of eggs she can produce. So, the greater the value, the greater will be the quantity.
How many are we supposed to?
Maybe more than 3 picogram. It's good. AMH of more than 3 is good. Less than 3, we need to be on a red alert zone, orange alert zone.
What are we talking about? On a monthly basis here?
Now, it
No.
is a one-time blood test
Okay.
that will reveal what is her egg quantity level.
Okay.
And trust me when I say this, women out there who are stressed too much have this potential of marked reduction in AMH value. So, the stress of not having a baby, yes, plays a significant role in reduction of the AMH level. Once we find the AMH is of good or it is on an average scale,
Yeah.
we proceed further by giving her medications or fertility drugs, to put it in one frame.
Yeah.
And we produce or stimulate her ovaries to produce good quantity of egg. from second day of her period.
Yeah,
Once,
yes.
sorry to interrupt.
Yes, doctor.
Once her eggs grows and reaches a particular stage of development,
Yes.
then she is scheduled for egg collection. This is the process from walking in the lab or walking in the clinic from day 2 of her menstrual cycle until she retrieves her egg.
Okay.
The whole process begins from second day, where she will be evaluated by blood investigations, ultrasonography, and then she will be given fertility medications according to her blood levels. And then we monitor her closely how the eggs are growing, and based on the growth of the follicles, number of follicles. By follicles, I mean to say it is eggs.
Yeah.
And on a particular day, when the follicles have reached a particular size of 18 millimeter to 22 millimeter in general, then we collect as many eggs as possible.
Okay.
Of this frame, we have 3 categories. One, low responders,
Okay.
where the follicle grows only up to 3. We can collect only 3 eggs. And 2, normal responders, where the eggs range from 4 to 20
Okay.
or 15, and high responders from 15 to 30.
These are like
Yes, standard.
very fertile.
Very fertile. But normal responders are very good
Yeah.
because we have a range from 4 to 15, and we have at least 8 embryos up to 8 embryos we can try to form. But high responders, in a condition like we get maximum eggs, in their condition we can freeze the particular content of eggs for future requirement.
So let me ask you this question. Based on what you just said just now, should some young people right now, some young ladies right now, are experiencing certain medical conditions which they probably will not be able to conceive in the near future, do you offer the possibility for these young women to consider freezing their eggs for future use?
Yes.
And what are the implications of that?
All right. Any woman who is having serious medical condition,
Yes.
any blood bleeding disorders, where she is on a long-term treatment, or any early cancer therapy treatment she is, like chemotherapy or radiotherapy, where she has to go through a long-term treatment for her medical problems, or otherwise she is not yet ready for pregnancy, and she is very afraid with the correlation of a blood value of AMH is going down, then she can take a call of freezing her eggs, and when she has completely got cured of the illness of whatever treatment she is going on, then she can go for her collection of her eggs from the center and going for the embryo formation.
How long can the eggs stay frozen before use?
Up to 3 years.
3 years?
Yeah.
Okay, all right. So a pan time of 3 years is what you can explore possibilities. These are all options putting in front of you. I know this is a sideline of the conversation, but I just wanted to add on to that so we can have that option to explore. Now, doctor, so the ladies are checked, the monsieur are checked. Now we have to come together and sit down and have a conversation with you.
Yes.
What happens there?
This is very, very significant part of any IVF treatment.
Okay.
When the couple comes and approaches, the step 1 will be the amount of stress they are going through for not having a baby in the first place.
Okay.
The couples are stressed and they are not able to reach out to the correct physician or gynae, and they are not able to talk to their family crew about the problem they are going. Step 1, we begin with proper counseling.
Okay.
Means we tell them what we are going to do for the male, what we are going to do for her, for his lady. And once they are clear about what is the procedure, then we move on to step 2. Step 2 will be analyzing the male partner, collecting the sperm. Now the sperms are collected. Now, from day 2, the women will be stimulated and we reach a certain stage of eggs, and then we collect the eggs, and again, now the women, now the real stress happens after the retrieval of the eggs, because now the woman is really anxious whether her eggs are of good quality, the quantity, everything. We inform the lady how many eggs has been collected from her. So this gives her an overall picture of how many embryos can be formed. From there, the process of ICSI, means ICSI, intracytoplasmic sperm infusion. We, as a gynae, I can understand this person, there is two category, IVF or ICSI. In IVF, in a kind of a petri dish, like a small saucepan, we put one oocyte and lot of sperms, and we allow the natural penetration of sperm into the oocyte.
So it takes place naturally.
Yes.
But it's just the surrounding environment is
in the lab.
Okay.
Yes. This is like multiple, numerous good, healthy, motile sperms. Anything can move forward, and we reach out for that embryo that gets fertilized and then moves on to a blastocyst.
Just like it would happen in the body.
Yes, similar. That is a very good way of response we get. Normally, this kind goes for maximum positive result. And I recommend this kind of IVF for people who have good sperm count, good motility. But on the other hand, the fault is like poor egg quality or recurrent miscarriages or not able to conceive on the lady's part, like tubal blockage or fibroids. So in these conditions, this variety of treatment can be taken up, IVF.
Doctor, pause. Let's stick to this treatment. We're letting the boys do their natural course, and of course, it's still in a lab. Now, one question that came in, which is interesting, because normally in the body, only one would reach the egg and fertilize it, would be the lucky guy, as we would say. But in this case, we are giving the possibility of many lucky little guys. So is there the possibility of perhaps twins or triplets happening in that course?
Yes. Multiple pregnancies are always very positive in IVF. About 5% of women, roughly 4.5 to 5% of women experience multiple pregnancies with in vitro fertilization because we provide a good environment and the oocyte. If two healthy sperms fuse in together, then there happens the magic of twins. So this is how multiple pregnancies happen with IVF. The chances really quite high.
So there is always the option of choosing at that precise moment?
Not really. We cannot choose how many sperms can fuse. It is left to nature in this kind of IVF treatment I said, where the eggs are placed in a dish and the sperms are allowed to swim. So we cannot identify which one will enter. But we have to wait, allow the fusion to happen and the blastocyst or the next stage to develop. That will be recorded on day 5 of the growth phase.
In terms of the number of pregnancies?
Yes.
This is what I mean. Can the person, the client, the patient choose, regardless of if there's like 2 or 3 fertilization, it's an option. Can Sylvie choose to have only 1 instead of 3 as?
You can. Ideally, we put 2 to 3 embryos inside because the uterus will take the best and it will start nourishing. So, normally 3 embryos, max, at the max we can put 3 embryos inside the womb.
Can it happen all 3?
Yes.
Doctor,
triplets. In that case, when the women's health condition doesn't cooperate for triplets, then one of the embryo, the defective one which is not very sustainable regarding on the placement of the embryo, then that is, I don't like to use the word destroyed, but that is set apart, allowing the rest of the 2 to grow inside.
But that's
freely.
a natural selective process in nature, isn't it?
Yes.
The survival of the fittest.
Exactly.
Simple.
Very simple.
It's nothing to do with human, it's the survival of the fetus. You got 3, whichever one.
Yes.
Yeah. Okay. All right. Now, interesting question that came in. Good morning, doctor. Sorry about that. Good morning, doctor. If I am sterilized, is this an option for me?
Yes.
Hey.
Bonjour.
Bonjour.
I would recommend, if she is sterilized, this is the perfect option for the lady. There are 2 options. One is, if the lady is in the age group of 35 to 40 years, highly fertile range, then the tubes can be reunited. And by naturally she can conceive. That shouldn't be a problem. If the tubes, that depends upon the length of the tube. The length of the tube that has been cut during sterilization has to be assessed by certain radiological procedure.
Okay.
Then as a gynae, I can understand this volume of tube is left behind for reuniting, or this amount of tube that doesn't support the reuniting process.
Okay.
So, first assess the condition of the tube. The condition of the tube, if it is not complicated, then we can reunite the tube and allow pregnancy to happen naturally.
Okay.
If not, don't take the risk, go for IVF, because the chance of ectopic pregnancy is quite high if the tubes are reunited.
And that's another problem on
That's
its own.
another problem,
That's another problem.
stress factor.
Yes, another stress factor. All right, we got some questions coming in. Good morning, and if you want to be a part of the conversation, pareil nous dit, aujourd'hui bon matin, dès 88, 89, 89, il numéro qu'on capable de partager aux questions. Et si vous pas envie de nous nommer ou non, nous pas besoin de nom ou non, mais aux questions est important. Et si on n'a aucun doute, aucune clarification, pareil nous tout en dit, ça y est option pour capable de demander aujourd'hui bon matin. So we move on from that. Now we've fertilized, they've got 3 beautiful eggs. Insemination of the egg process.
Yes.
Walk us through, doctor. Is it, let's be honest. The first question that pops in the head, a lot of people probably thinking, is it painful? Is it not painful? Is it under anesthetic? Or talk to us, doctor. Take away our fears.
Yes.
Yes.
We will begin from egg collection. Because for egg collection, the patient will be anesthetized with a minimum dosage of drugs. Means she will be sedated for 10 minutes.
Okay.
For her to be relaxed, because any stress will rise the cortisol level, and there you see that is the collection process.
Yes.
The syringe that shows then the next step where the eggs are retrieved, and then from there the single egg with the sperm, the third figure, and fourth, that is the 3 embryos which I am talking, and the fourth in the uterus, the eggs are placed, the embryos are placed, and lastly we get the urine pregnancy test positive.
And everybody's happy.
Everybody is happy. The couples are happy, the
Yes.
baby is formed. For egg collection, yes, a minimum anesthesia is given,
Okay.
and it is a simple, we don't cut open and retrieve the eggs.
Yeah.
We do it vaginally by a ultrasound guided probe where we have very thin needle.
Okay.
There is a papain no female.
Okay.
No
N'a pas
one.
fait mal.
No female.
pas fait mal.
No female. And that is the process. The
Okay.
uterus, the probe which I spoke of, it is the green one, and the thin needle that reaches the ovary. As you see there, the needle reaches the ovaries and retrieve the eggs from the ovaries.
Okay.
This is the exact picture, and she will be absolutely pain-free.
Okay.
And this procedure in toto takes only 15 minutes.
Oh, wow. It's very fast. huh?
Very fast. We need to be really quick, because
Okay.
collecting the eggs
Yes.
and immediately putting it in the storage container
Yeah.
and passing it into the lab. The embryologist is there waiting for the eggs. So there is the time frame, the sterile zone, and the transit of the collected eggs to the lab is very, very important. So the collection area and the embryology lab is always close by with a small window,
Okay.
and we pass the sample in a very sterile manner. So the collection is very sweet. And after 15 minutes, the patient is wide awake,
Yeah.
back to normal. She's back on her feet.
Any
And
pain after this?
N'a pas mal.
N'a pas fait mal.
N'a pas
Okay.
fait mal.
N'a pas fait mal. Docteur dit n'a pas fait mal. Okay.
No pas mal.
Okay.
She's absolutely free.
Okay.
And now her process is complete. Now it is in the hands of our team,
Right.
because now the fusion occurs either in a dish as I spoke earlier, or collecting one egg and one healthy sperm and fusing it together,
Yes.
putting it together,
Yeah.
preparing that one good embryo.
Okay.
And then in that way we prepare at the max of how many eggs, if the lady can produce, to the max 6 embryos in the first set.
Now we're talking about ladies who are between 35 and 40. Let's say between 40 to 45. What are the chances?
The chances of egg quantity reduces as the age of the women advances.
Okay.
It is not about the quality, it is about both the quantity and the quality.
Okay.
The AMH will significantly reduce the number of eggs, and of the above which we collected, the quality of the eggs that is healthy enough to fuse with the sperm is a real challenge. So, all women out there who are reaching their mid-40s, please plan your pregnancy ahead.
Okay.
Never postpone the pregnancy, or never think this is not the right time for me to get pregnant because I have a lot of commitments. No, health comes first, family comes first. If you have decided to have a baby, have it at the earliest in a natural way. As a gynae, I recommend natural way.
It's less stressful, isn't it?
It's absolutely stress-free, and it is a joyous moment to have the baby inside the womb, formed naturally, holding the hand of the partner, and then walking aside into the labor ward, delivering the baby.
Yeah.
This is absolutely a natural phenomena, having a good response mentally, physically. As a woman, she is able to feel the motherhood right from the beginning.
Yeah.
On the other hand, taking IVF, everything, the first thing that tunes into the mind is it is an artificial technique.
Yeah.
It is not a natural way. So, once it is an artificial technique, then the woman is stressed out. She has to go through the stress. She has to come to agreement with herself,
Yeah.
tune with herself, prepare herself and her partner, get ready for this whole process.
Because it's mindset, isn't it?
Yes.
Mind
very
over
true.
matter.
Yes, very true.
Yes.
And after the embryo is formed, we wait for 5 days. Slowly the embryo divides. And then on 5th day, we can see the growth of the embryo into a blastocyst. And once at this stage is recognized in the microscope, on day 5, the embryos are ready to be put in.
Doctor, I have an interesting question. Good morning, doctor. What if a lady has fibroids and is above 45 plus? Can she, what are the chances of conceiving? Let me just throw another question in, which is almost similar to this. Good morning. Please ask the doctor if IVF is an option for someone who has endometriosis and fibroids. If so, what are the rates of success?
All right.
Now, same question.
A woman condition is complicated.
Okay.
I'm trying my Creole. The condition is little complicated.
Okay.
Because this is two different questions.
Yeah.
Fibroids are different and endometrioma is different.
Okay.
But the first question I would answer, first we have to assess where is the position of the fibroid.
Okay.
Whether it is close to the uterine wall, where the womb is supposed to be receiving the baby.
Yes.
If it is far off, we can wait. Because it is not disturbing actually the baby that is placed inside the womb, then we
Okay.
can be relaxed.
Okay.
But if the fibroids are bigger and it is damaging the space, narrowing the space for the baby to be received inside, then these fibroids have to be removed prior by, now we have laser, laparoscopy, keyhole surgery,
Yeah.
where we remove the fibroid, reconstruct the uterus and prepare her womb to receive the baby. Yes, 45 is a challenge, but we have the wonderful, beautiful option of IVF. She can give her egg, she can collect the sperm, and then by this one egg, one sperm, ICSI method, we can prepare the embryo and put it inside her womb after her uterus is healed of the fibroid.
Okay.
This is question
Number
number
one.
one.
Now,
Number 2, switching, endometrioma. The endometrioma now becomes a real challenge.
Okay.
Because the ovaries are producing eggs,
Yeah.
but they are not able to release it.
Okay.
Because eggs try to grow multiple. It's like it tries to blooms every month, but it gets arrested because of the thick ovarian wall.
okay.
So, in this condition, the challenge of producing a good quality egg comes a major challenge for the gynae. So, the condition of endometrioma has to be corrected first.
Okay.
Again, we have laser, laparoscopy or keyhole surgery correcting the endometrioma, leaving the healthy ovary behind, allowing the healthy ovary to recover.
Okay.
And then we give medications to procure good quality of eggs.
Would you encourage the person to probably consider to freeze a few of the eggs, or just leave it as it is, treat the endometrioma, and then we move on to conceiving?
That is a very nice question, Sylvie, because in endometrioma, the same go, we don't advise them to get ready for egg collection, because all the other follicles will release the negative hormones which doesn't allow the eggs to grow. So the quality of the eggs freezed at that stage, particular stage, is, I don't think that will result in a very positive way. So it is always best to get treated for the condition, get cleared of the condition, and then go for the proper medical management of egg stimulation and retrieval of eggs.
Interesting question, doctor, came in. I know it was going to come. With everything you've explained, it brings hope for ladies and gents alike. However, we always have the option of the cost of it all. Are we at liberty to discuss that?
Sylvia, I really don't feel that this is the ideal platform to discuss the cost, because every center has got their own packages, and say above all, it differs from person to person. For certain, I will say, for example, there is a way called minimal stimulation or mini IVF, where the lady doesn't have to go through any medications at all by injection. She is given minimum stimulation. She is young, she is less than 35, but has a problem with the male partner, then she doesn't require all the high expensive medications. We go with the normal medications. We screen her by ultrasonography. When we see the growth of the eggs, then we collect the egg. This minimum stimulation IVF is less expensive compared to the other two I explained. And the cost, yes, it varies from center to center, but still it depends upon the partners about their need for the baby.
I mean, it's a joint conversation. I think that you sit with it and, of course, explore all the options that are available in front of you. Now, a question that comes in this morning, we've talked about the treatment. Is this treatment happening locally, or is this treatment being done elsewhere, overseas?
This treatment, I do it in my hospital overseas. Here locally in Dr. Murthy's.
Excuse, yes?
Yes. In Dr. Murthy's, Sorry
about that.
It's okay. Are you okay?
Yes, I'm good. I'm okay, doctor.
Shall we proceed?
Getting a little cough right there. Okay.
No problem. So, at Dr. Murthy's, we do the basic screening, where both on Friday, we give a special offer package for the couples to reach out to me. So, in this package, we do the registration. It's an early bird offer. And it is a new year, we give the new beginning. So, on this package, the male partner will have the semen analysis done, his basic blood investigations done. For the lady, we do an ultrasonography and AMH level done. So, all these 4 tests will give me an idea what is the condition of her which is preventing her to become pregnant naturally. So, the general advice of the fertility query will be answered spot on Friday. We have this exclusive camp for this IVF at Dr. Murthy's. So, all the couples who are interested to know about the fertility query can reach out to me. So, this level 1 is done here, and level 2 is done in my hospital at SUGAN at Chennai, SUGAN STEMS IVF, and there we do this procedure of IVF.
How long does it take? Because if we're traveling, of course, there's all of that to take into account. How long should they be staying over?
This is a very, very interesting question and needed also. See, if the couples are working and they don't have the liberty of taking leave, then the male partner can come, can give the sperm, then he can walk back to the work. The total days he will be required to stay in overseas, in my place in Chennai, it will be only 5 days.
5 days,
It's for the male. But for the lady, she has to report 2 days ahead of her menstrual cycle. Then throughout the menstrual cycle, she will be monitored with injections and ultrasonography until day 18. So, 3 weeks in total for the lady. And then they both can fly back to the country. Then we do all the work, we prepare the embryo, we prepare everything, and after 3 months, after prepping her uterus, when she is mentally free and ready to accept the baby, they can fly back and put the baby inside. This is option 1. Option 2, if there is the liberty of her giving enough time for her to receive the baby,
Yeah.
then the lady can stay back, and on the same month, after the day 5, after the eggs are hatched, to put in that way, we place the eggs inside, embryos inside, and allow the baby to grow. After 18th day until the 10 days wait is mandatory.
Yes.
And I counsel them enormously not to get stressed, because the stress hormone cortisol will destroy the embryo after all the pain she has gone through.
Yes.
So she should be.
So there's pain, doctor.
No,
Ah!
no, it is the mental pain.
It's a okay.
It is the mental trauma.
Mental.
Trauma.
Release yourself from mental slavery. It won't
Yes,
happen.
yeah.
You will be good.
So,
okay.
the scale, she has to be on at least neutral.
Okay.
If not, she is not neutral. She shouldn't be depressed.
Okay.
She shouldn't be anxious. We address the issue of anxiousness, because when will I become pregnant? When will the embryos? Is my embryos hatching well? We keep them updated daily. How many are formed? How
Yeah.
many are dividing? How many are moving into the next level?
Okay.
And once the embryos are placed, then she is given certain medications to receive the baby. So in 10 days time frame, then we do the urine pregnancy test.
Yes.
And there comes these, fingers crossed, 2 lines, happy news, good news, and the miracle of baby.
Are we monitored after this? Still? Do we have to remain?
Not really.
No?
Once the pregnancy test has been positive, then she can fight. No problem.
No problem.
No problem.
All right. Doctor, I've got one question that came in. Morning, can you kindly ask if ovarian cyst affects conceiving, doctor?
Yes, it's very true. Bonjour to her.
Yes.
And ovarian cyst interferes with consumption, because a cyst in the ovary, number 1, it occupies space. Number 2, I do not know what the lady has referred, whether it is PCOS, polycystic ovary, where small cysts are formed in the margins of the ovary,
Okay.
or it is a single cyst. Either way, it interferes with the growth of the egg and releasing the good quality of egg. So, correction of cyst is mandatory for any woman.
Okay.
But before everything, she needs to approach a gynae and find out what is the cyst. Is it physiological? Is it normal? Or is it abnormal? So, based on this, we remove. I do it by laparoscopy here in Dr. Amurthy's, no problem. And then she can plan her pregnancy after a month of rest.
One question which I think we've answered, but just for clarification to hit back to that, in case the person wants to know. Hi, bonjour. Moi, 47 ans, 47 years old. I am sterilized. And I'm just checking if this is a procedure that is possible for me. I mean, we covered that, but just clarity, doctor. I
Yes.
know some ladies really want to know.
Bonjour to her and tell her that it is significant for
Yes.
her, and this is the way available for her to get pregnant again, because having sterilized, reaching the age of 47, it's highly she is on the low ovarian reserve. It is at the earliest she can approach and reach out to know how many quantity of eggs she is having. Step 1, go for the ultrasound, go for the AMH.
Okay.
And that will give me an idea what is the fertility ratio, and based on that she can plan her pregnancy.
Okay.
But believe me, we have made a woman at the age of 56 to get pregnant. Yeah.
Miracles to happen.
Yes, miracles always happen.
One question, doctor, from the test that you did when you checked the boys and the ladies, okay, the swimmers and the ladies' eggs, is there a possibility to see, for example, sometimes we are told that certain sperms and certain eggs are not match.
No.
Is that a myth? Can we debunk that?
No, that is a very advanced technology.
Okay.
See, this is a particular condition of genetic you are
Okay.
discussing.
Yes.
See, the person can have recurrent miscarriages.
Okay.
Then the quality of sperm and the quality of egg doesn't match.
Okay.
That leads to repeated abortions. Yes, there is a condition like that,
Okay.
where that particular sperm with the particular genetic transition doesn't match with the egg.
Okay.
So in that case, we have an advanced technology where we go for one good quality sperm with a good genetic composition and good quality egg with good genetic composition and fuse it together. That is the most highest, what do you say, very expensive technology,
Yes.
but still, yes, there is an available option for that.
Okay. Well, somebody wants to know, after 42, some women have a lot of difficulty to conceive. Why is that, doctor? I think we've been through that, but I don't know if you want to take that again, doctor?
Yes, I would like to, because since it is
Yeah,
a point of
it's a valid
concern.
question, yes.
It's a point of concern. Every
Thank you for
woman,
reaching out.
every woman after 37 years, we
Yes.
need to be aware. 35 is the margin. From 35 to 40, we should be on an orange alert.
Okay.
The body undergoes hormonal changes. Whatever fertility ratio we were before, it
Okay.
will slowly scale down. And after 40, yes. With every year, yes. So we need to be on a margin. We have to plan the pregnancy
Yes.
before 45.
Okay.
That is the last.
That's the. However, doctor said 56. The
Yes.
lady. Yeah. So it can be done, but if you want it to be in a natural process and you want to enjoy the moment, not that I'm saying you can't when you're going through your IVF. I mean, it's, as we said, it's mindset, isn't it? If you
Exactly.
prepare yourself for all the options, you keep yourself an open mind, and you remain calm and you remain hopeful, there is a way.
Yeah.
Miracles always happen, doctor, right?
Yes,
She
miracles
said it, not me.
always.
She said, I'm just quoting the doctor here. Another question that came in, hold on a petit moment. Bonjour, I'm 47 years old. I'm a 47-year-old lady. Thank you, doctor. You've given me hope. I'm smiling. It's the best news of the day for me. Oh, we're very happy to share that with you.
Bonjour. Mokatawu for
Aw.
her. If I can bring some hope to
Yes.
any one woman, then that is the whole purpose of this whole
Conversation, yes.
conversation we are going through.
Yes.
And if that brings hope, then definitely she can stay positive. See, staying positive and having high hope releases all the happy hormones. When the happy hormones are released, then the quality of eggs improve. And when the quality of eggs improve, the consumption occurs naturally.
Exactly.
So it
And
is us.
everyone is happy. Now, I'm going to be a little bit of on a scandalous part about it. Now, we have a lot of ladies who perhaps don't have a male a partner, but she's reaching that point in her clocks are ticking. And she decides she's independent financially, she's stable, she has all her things right, all her ducks in a row, and she wants to have a baby, and she's ready to go through that process alone. Can there be an option of sperm donation? Is that an option? Because certain countries do. But, doctor.
We don't have to be skeptical about it.
Yes.
Yes, we do have sperm banks.
Okay.
And based on the quality of the eggs and the importance of the baby formation or
Okay.
the necessity for the baby, then we do a certain amount of test in her, like blood group, which will match the
Yeah.
sperm, and then we collect the sperm, or we recommend her to ask her the priorities.
Okay.
And then based on the priorities, we buy sperm from sperm banks.
Okay.
Yes, we have.
So that is an option out there for the ladies.
Yes,
Okay?
if there is no male partner,
Yeah.
don't have to worry. If her clocks are ticking, then we can borrow sperms. No problem.
Well, there you go. Ladies and gentlemen, we've got you covered. Doctor, I don't know if there's anything we've missed out in this conversation, but I'll give you, because time is of essence, as we say.
All right.
So I'll give you,
Yeah.
yeah.
The last frame which I want to throw highlight upon is, after conception by IVF, is it normal to have a natural delivery?
Interesting
Because-
question. Yes, doctor.
Because after an IVF, still the baby is a normal baby inside her
Yes.
womb. So the lady can have a normal vaginal delivery. This does not indicate for a C-section or any other mode of delivery. After an IVF, she will be carrying her as a normal pregnancy.
Yeah.
Though she has conceived by artificial technique, after the conception, she is carrying the baby inside, which is a very natural phenomena,
Yeah.
and she can have a natural birth after that. So I reach out to all couples out there to come out of the shadow of reaching out what is the problem running inside.
Yeah.
Speak out. Reach out to your family or friends or to the gynae. I'm here every month.
Yeah.
They can come approach me and they can assess find out what is the real problem. Where is the real problem? Is it the male partner or the female partner? Or if both? In that case, then we can decide what is the fertility ratio, and based on the fertility ratio, we can always decide the plan of treatment. By God's grace, we have all the technologies available here, and miracles always happen.
I think this is a beautiful ending to the conversation this morning. Miracles always happen, and you just have to be relaxed and hopefully enjoy the process.
Yes.
And keep an open mind.
Yes.
Yeah?
Yes.
One last question, doctor, before we wrap things up. I just wanted to add to that. I saw it coming in. After the conception, would there be necessity to come and visit you again?
Not in the overseas, but I visit Cecile every month, so she can have a regular checkup here. It's only the process of IVF done overseas. After that, her consumption, she can come back to the country, and every month she can have a consultation. Not only with me, with any gynae here, she can have a natural visits, antenatal visits, checkups done here. She need not fly back again. It is only the one step where she has to fly for the embryos or the eggs that has to be done, the process.
There you go. And then after that, miracles always happen. On this note, mesdames et messieurs, Dr. Sigan, thank you for coming. It was an absolute pleasure meeting you this morning. And thank you for answering the questions of the ladies. And hopefully they have enough information to consider and to sit with their partner and have a conversation about that as an option.
Merci beaucoup, Sylvie. This was a wonderful conversation, and I really find this topic, which is very skeptical to be discussed on a platform like this, and I sure we had thrown some light on some women who can understand what is running in their fertility part. So I believe I have reached out, and please, to all women or all persons who are trying to conceive, reach out to me on Friday. At Dr. Murthy's, we are conducting a special camp. So they can reach me out. For bookings, they can contact the reception or the number 27509999 or this number, they can reach out. And I can give them at least a guidance of what has to be done. And I really enjoyed this conversation with you. Likewise, mon PV pass, place later, Cecile.
So ladies, have this conversation with your partner. Decide on what is the next course of actions. And if you are an independent lady and you feel you are financially able, financial freedom, you got your ducks in a row, and you don't necessarily have a partner, but you want to have a baby, that is also a conversation you can have avec doctor. And couples in general, if you feel that maybe your little swimmers are not working properly or her little eggs are not doing the right things, Dr. Sugaya is the lady to take care of that. Have a conversation with her. Meet her on Friday. Yes, doctor?
Yes.
Definitely on Friday. She will be meeting you guys. And of course, take it from there and have the conversation. But always remember, keep that in mind. Miracles always happen. On this note, ça c'était une Topik Konversasyon pour aujourd'hui bon matin.
Merci beaucoup. This is Dr. SUGANYA SARAVANAKUMAR signing off. I am from Sugan Hospital, Chennai. Dr. SUGANYA SARAVANAKUMAR signing off from Sugan Hospitals, Chennai. Reach me out and always believe miracles always happen. Love you all ladies out there in Seychelles. Mokota. Thank you.
Well, there you go. On this note, ça c'était une Topik Konversasyon pour aujourd'hui bon matin.